Good afternoon, everyone. Thank you for joining us on this kind of rainy and chilly Wednesday afternoon. I've got several things to chat with you about today, COVID related, talk about evictions, talk about the vaccine a little. We'll talk about New Year's Eve a bit, and we'll talk about the weather and any possible precipitation. So let me begin by, and of course, we will take your questions. Let me begin by going through the COVID numbers with you. Number of positive cases is down pretty significantly. The average number of cases per 100,000 for the city is about 29. St. Louis County's 42, St. Charles 34. All of the areas are down. Now, the pandemic task force, met with them or talked with them yesterday, and the number of positive cases are down, but the number of tests are down also, because of course there weren't a lot of people getting tested over the Christmas holiday. So you had Christmas Eve almost a week ago now, then Christmas Day, the day after. So we're happy that these numbers are declining, and the average number of cases is down, but it is also not something that we believe we can rely on to hold up over the next week or two. We know that there were a number of people traveling over the holiday, a number of people still traveling, and just folks getting together with family and friends and celebrating. And so we are concerned that there will be a surge within a surge, and that the number of cases will go back up. So just saying that we're happy these numbers are down, but we also know that that those numbers may not hold up. In terms of number of people in the hospital, down a little bit, but not a lot. Yesterday, and this number, this lags 2 days behind, so this is really Monday's number. 856 people were in the hospitalized with COVID positive. Another 87 people were suspected of being positive, but the test hadn't come back yet. So 943 people in the hospital 2 days ago. It's down a bit. It had been up in the middle of December. It was up over 1,000. So we're down 50 to 60 people from that previous high. 187 of those people, of the 943, were in the ICU. So about 20% of the people that were in the hospital were in the ICU. And then 116 of those folks in the ICU were on ventilators. So 60-70% of the people in the ICU were on ventilators. Patients admitted 2 days ago was 110. Patients discharged was 119. So we'll post the pandemic task force charts and numbers here in a minute, but if you take a look at it, what you see is the numbers going up, and then down a bit, and just sort of hovering there. So we're at a bit of a plateau, and really hoping not to see another surge up after the activities of last week and this week. So those are the COVID numbers. I had the chance this morning. I had a good conversation with Dr. Randall Williams, who is the state medical individual, to talk about vaccines, because, a week or 2 weeks ago, I guess, when the first vaccines were administered. And of course, when that happened, everybody wanted to know, wait, when can I get mine? When can I get mine? This is, as you know, if you've been watching the news, it's a pretty complicated logistics situation. The federal government said that they wanted to have 20 million doses by the end of the year. Well, the end of the year is tomorrow. And of that, Missouri would receive, based on population, about 400,000 doses. And then there would be a similar number of doses, 400,000, waiting to get shipped in order to give the second vaccination. So far, the state has received 51,000 doses initially, but there are another 312,000 that have been shipped to the state of Missouri. Now, some are here, some are still in transit. Half of that 312,000 are going direct to nursing homes via CVS and Walgreens. Group 1A is healthcare workers. There's about over 300,000 healthcare workers in the state, and nursing home residents and staff. And there's about 130,000 of those. And so they are in the process of getting their first vaccine now. And next week, probably about this time, some people will begin getting their second dose. Group 1B, which will be after healthcare workers, nursing home residents, and staff get vaccinated. Group 1B includes folks over 65 and folks who have chronic health conditions such as asthma, heart disease, COPD, etc. So they will be in the next round, and that Dr. Williams said that he is hopeful that those people would be able to start getting vaccines around the end of January. Now, as you know, this is all dependent on production by Pfizer, by Moderna, and the distribution from the federal government to the state. In that second round, first responders, fire, police, EMS, particularly EMS, folks who work on ambulances, will be included in that second round. So hopefully around the end of January. These are receiving the vaccine is not really within our control completely, but we know that the federal government is ramping up and shipping more and more. Everyone's a little concerned and nervous about that because we know it is a real logistical situation there. But I think that was all good news, and at least it is an expectation to set. Right now, there have been, I wrote this down somewhere, about 66,000 healthcare workers vaccinated so far. That's, of course, the first vaccination. And many more. This is ongoing day in and day out. So, excuse me, we are, that's a good start, but of course we all need much more. All right, that's it for my, I appreciated Dr. Randall Williams taking the time to really talk me through this, and they are putting together these plans and doing this distribution as quickly as possible. New Year's Eve, that's tomorrow night. So, bars and restaurants will still need to follow the orders, the health orders that are in place. And that includes closing at 11. I know New Year's Eve is until 12, so pretend you're in another time zone. Excuse me. So New Year's Eve, celebrate a little bit early. And just remember, if you're out, all of the health orders are still in place. Got to be wearing a mask unless you're seated at a table actively eating and drinking. Got to be seated and at least 6 feet apart. Your tables have to be at least 6 feet apart. So it'll be a little different New Year's Eve than it has been in the past. But it's important to remember those things. Some of our folks will be out visiting various parties and events that are going on. So please be sure you're leaving by 11. And Happy New Year just a little bit early. What else do I have here? I should have said this a little earlier. Did I talk about the eviction moratorium? I didn't, okay. Circuit judges have issued an extension on the eviction moratorium until the end of January. It was set to expire tomorrow. And that eviction moratorium says that you can't be evicted for not paying your rent unless you're committing a crime or you're tearing up the apartment. There are situations where you can be evicted immediately. So if it's simply for non-payment of rent, though, you cannot be evicted for the next month. We still have about a dozen subcontractors who are processing rental assistance, rental and mortgage assistance. The new CARES Act has allowed that to go on into 2021. We're happy about that. We were assured, as much as anyone can assure what Congress is going to do, we were assured that that would take place. It finally did yesterday when day before yesterday, I guess, when President Trump signed, I call it CARES 2. And so that's a plus as well, that we can continue to use those funds. There have been about 2,000 people in the city of St. Louis so far that have had their rent paid. This number is about a week ago. It's last Friday, so not quite a week, but it was 1,911 folks who had been processed. It's a complex process, requires a lot of documentation. We really appreciate those folks that are helping, that are processing those applications, because it's very important to get that to people.
Units, not people.
Yeah, Jacob just pointed out to me, and he's correct. It's 1,911 units, not people. Of course, most units probably have more than one person in them. And so, it's 3,000 or 4,000 people that have been helped, but 1,911 units where the rent has been paid. So, what else have I got here? Oh, let me talk just a minute about, our street department is continually watching the weather. We actually have someone who updates us continually on weather. As of right now, and we all know the forecast can change, but as of right now, the rain's about to stop, we think, pretty soon, and then start up again tomorrow afternoon. So it looks like we're going to have a dry overnight. That's the most current. Then start up tomorrow afternoon. Forecast looks like the temperatures will be high enough that it will be rain, not snow. I know some of you want snow, but we're happy it'll be rain here. So we think that right now, I'm looking here to make sure, no real activity that we know of right now with regard to any pre-treating or that kind of thing. Can't pre-treat now while the roads are wet. It just washes off the pre-treating. So we're watching this. Our street department watches this continually when we're in this situation where we're right on the bubble between freezing and not freezing. The ground is still fairly warm, I'm told, and the roads are still fairly warm, I should say. And so we think we're going to get through this without ice or a snow event. That can change. And then lastly, the reason we started a little bit late today is that there was a Board of Estimate and Apportionment meeting, a special meeting this afternoon, and where we authorized 2 more shelters, homeless shelters. And these are temporary, will be opened here middle to late January to get us through the coldest part. And that will be Tandy Recreation Center and Cherokee Recreation Center. Each of them can house 30 or so people. And then in addition to that, we have purchased and contracted for someone to operate some mobile showers. So there are still some encampments that have been set up for a long time. So we will have these 2 mobile showers. Each, it's a trailer, Each of them has 3 bathrooms in it. It's a toilet, a sink, and a shower. And they will go a couple of times a week to the encampments where folks can get a shower and just be able to clean up and feel a little bit better. That's for folks who are in the encampments and are unwilling to go into other types of shelter. So, that was all I had to talk about today. Do we have
That's
questions?
all.
That was a lot, I know. Do we have questions?
Yeah, just a couple of questions. So, starting with COVID-related matters, general questions, Mayor, about the vaccine being available to the general public in the city of St. Louis. There have been reports that that's getting pushed farther and farther. Do you know when that might be?
It's months, not weeks. I think that is the most anticipated way of saying that. Because you gotta get through healthcare workers, gotta get through nursing home residents and workers, have to get through first responders, have to get through corrections, people living in congregate facilities, people over 65, I failed to mention that first, and there are about 1 million people in Missouri that are over 65. Randall Williams estimates that there are probably about 700,000 people that have chronic health conditions. Now, there's some overlap there. Some of the 700,000 is, also over 65. So there are 2.5 million people that fall into those first few categories. Now, we know that not everyone is going to take the vaccine. Dr. Williams said today, they're looking at about 60%, and they're hoping, of course, that number will go up as people get more comfortable, as the results of other people taking the vaccine no negative effects. So hopefully that number will go up. But right now, they're looking at somewhere in the neighborhood of 60%. So if you just think about that and the number of doses that are coming out, it looks like, the general public that doesn't fall into any of those categories is looking at a couple, 2-3 months away. So not to beat a dead horse, as they say, but we're going to have to continue with these mitigation procedures. We're going to have to continue mask wearing, social distancing, and so that we can have as little spread as possible.
Does the city of St. Louis have to come up with its own distribution plan, or are we dependent on what the state gives us?
We are dependent on what the state gives us now, because we will have to figure out how to get these vaccines administered. We have federally qualified health centers that are very involved in this. We have, of course, hospitals. After hospital personnel get vaccinated, then you have lots of doctors and doctors' offices and that sort of thing. So, but the actual, we can't decide, we're going to vaccinate 30-year-olds instead of medical professionals, first responders. It doesn't work like that. So this is a free federal vaccine, so we have to go with their guidelines.
We have a question about indoor dining and COVID. Are there any talks of changing any of the rules about indoor dining in the city of St. Louis? That's from Corinne.
Corinne, the indoor dining rules that have been in place for a while now are going to stay in place for a while longer. I do not see a time that those will be lifted in the near future. So 11 p.m. closing time, social distancing, mask wearing, all of that needs to stay in place for the time being. I mean, don't forget, we are still have a raging pandemic going on. And while it has tempered just a little bit, we have still plateaued for the last few weeks at an extremely high rate. So,
Dana has a question about New Year's Eve. Midnight is just 1 hour past the 11 p.m. closing time. Can the city not let places stay open for just 1 more hour?
I know it's I hate to be the bearer of that, but really it is It's highly contagious. I think people need to set their watches up so they think it's midnight when it's really 11 or when it's really 10. We're not going to lift the requirements just for New Year's Eve. I mean, most of the St. Louis County, of course, they're not even allowed to be open. So,
CARES Act 2, Mayor.
sorry.
CARES Act 2, Mayor. Does the city of St. Louis know what funding opportunities we might be able to benefit from the new legislation passed in DC?
So, yes, we have a lot of information about CARES 2, we'll call it. And when you say we be able to benefit, let's talk about this just from a person point of view. Right now, it looks like the $600 stimulus for individuals who make under $75,000. It's actually who made under $75,000 last year, 2019, and those who and couples who make under 150 who file a joint return will get $600 each, and each child will also get $600. Those checks or direct deposits will begin coming out very, very soon. In addition to that, there is additional money for mortgage assistance, for rental assistance, not mortgage assistance, but for rental assistance. There's additional funding for PPE. There's also additional funding for small businesses called PPP, Payroll Protection Program, PPP, which is a forgivable loan if you spend it on the things that are required, which is payroll and few other necessary expenses. So there's a lot in that package, but most importantly, I think, is the rental mortgage assistance, the assistance for small business, and the assistance for individuals.
And I think last question we have is from Lynn. You sort of addressed this when you talked about E&A, Mayor, but the homeless camps around the city, are there continued opportunities to provide them with shelter now that the temperature is dropping?
There are. That's why, as I mentioned earlier, we will be opening in the next few weeks 2 new shelters. These are temporary emergency shelters at Tandy Recreation and at Cherokee Recreation. And we also have the tiny houses, which are going to be opening here in just the next few days. At least they'll begin with their first few residents to the tiny houses.
That is it, 2:45.
That's it, 2:45. Thank you all for being with us today. Let me just say, Happy New Year. Have a nice, socially distanced Happy New Year. I, for one, say good riddance to 2020. And I'm looking forward to 2021 being a better year. I think it will be. We have this vaccine on the way. We're not there yet, but we can see the light at the end of the tunnel. I think it's a little longer, a little further than we'd like for it to be, but I'll be ringing in 2021 early this year as well. Thank you all. Appreciate you being with us.